Welcome to our Wednesday call every single Wednesday, 7 p.m. around Medicare training. And tonight we're going to be talking about some housekeeping items, some stuff that we need to go over, and some updates on how to make sure that your AEP is going to be successful. So I get a lot of questions every single day. We're writing a ton of apps every single day, and it's amazing to see everyone with their success. And it's just awesome to see that. It's awesome to see people that have never written any Medicare apps come out and they've already got 20 plus applications 4 days into AEP. I think that's really a phenomenal thing to see that many agents go out there and write that much business. And we're just seeing it with dozens of agents that are just doing it and performing at such a high level. I'm just so happy that everyone really took the Medicare side and started to run with it and did such a phenomenal job. So I really appreciate everyone, first and foremost, for going out there and doing it and just hustling nonstop. You guys are just crushing it. So there's definitely some stuff that we want to cover to make sure that whenever we are out in the field, we can have all of the different things that are, I would say, like some of them are kind of like minor things that you should know as an agent, right? And obviously I would say most of y'all on this call probably know it. So I might just be preaching to those that are already doing it. And there's some people that aren't on the call that do need to know it. So with that said, let me go ahead and pull up some of this stuff. So, all right. One question was, what do I do with my existing clients? So existing clients, you don't need to do anything. You don't need to go back and write them or anything like that. You only need to go back to the client if you're writing a new plan for them. So if you're not writing a new plan for them, the plan automatically renews next year. So anything you wrote in 2021 or prior to that, it automatically renews. You don't need to go back and submit another application for the plan that they're already in. It's just going to be a duplicate and will get declined. So that plan is automatically going to renew, hence your renewals, and that's what kicks in. All right, the next thing I want to talk about that's really important as well is internal replacements. So I see in Dallas County that they rolled out this killer plan, and it's called the Humana USAA RX PPO. So it includes prescription drugs. The only qualifications you need to get it, just like all Medicare Advantage plans, is having Part A and Part B. So you have Part A and Part B on that red, white, and blue card, you qualify for it. It's a $75 give back on a monthly basis. So a lot of people that I see with Humana Gold Plus, they love that plan. I would go in and I'd sit down. I'd go over the United Healthcare, the WellCare, the Cigna, it doesn't matter, Aetna. I look at all the different companies and I give them comparisons, and there's like, hey, I want to stay with what I got. Okay, that's fine. So I didn't really have any ammunition. There's really nothing else out there that I could offer them from that company. So you're always looking at the market and what's changing, what's going on. It did Aetna, and in my area, Aetna removed some plans. My rep sends me emails. They send it to everyone, and I forward the emails to you guys when I get the ones that are applicable to the masses. So with that said, I look at it and I say, okay, they rolled out this great plan. Now I know if I'm sitting down with someone that currently has the Humana Gold Plus plan, I need to talk to them and I need to tell them, hey, this is the new plan that Humana rolled out for 2023. It's the USAA, it's a PPO, and they pay $75 a month of the Part B premium. So that's a huge thing. It's got $3,000 in dental. Here's the downside. The downside is that your copayment when you go to the primary doctor's office is $10. The downside is that your copayment when you go to a specialist is $40. Right now, you're paying $0 for a PCP and $20 for a specialist. So what does that mean? So if a client is relatively healthy, okay, and they don't go to the doctor that often, then this plan makes sense. And they're paying the Part B premium. This may not make sense if they're paying the Part B premium. In fact, it doesn't usually at all make sense, right? There's no real reason for them to go into a give back plan if they're not paying the Part B premium. Okay. So with that said, so all that I do is I just take out a calculator and I start doing math with the client. I take out my pen, I take out my paper, I look at it, I write it on down. I say, all right, how many times do you go to the doctor a year? I go about your primary doctor. I go 2 times a year. I go once every 6 months. All right. So that would be $20. All right. So PCP right now with Humana Gold Plus is $0. But the PCP with the Humana USAA is $10 times 2. That's $20. Okay. How many times you go see your specialist? I go once a quarter to see my heart doctor. Okay, so instead of you paying $20, it's going to be a $40. So it's a $20 difference. That's 20 times 4. That's an additional $80 that you would incur. So I just add that up. $20 difference to see the PCP, and then $10 difference to see the specialist. That's an additional $100 that you'd have to pay a year. Then I take out the calculator. I say, all right, 75, and I'm showing this. I'm walking them through it. 75 times 12 months in a year, that's $900 is what they will have in a give back. Okay. You're going to incur an additional $100 in copayment at a cost copayment when you go see your doctor. So that's $100. 900 minus $100 is $800. So you win. Other than that, your prescription drugs, you look at it, they're generally going to be the same, right? It's still Humana. It's Humana's network. The formulary is, you're going to look at it in Sunfire. You're going to type everything in to make sure everything's pretty much identical as far as that goes. The dental's 3,000 with the Gold Plus, the dental's 3,000 with the USAA. They clearly know what they're doing and how to gain market share. It's a very attractive plan. So in the end of the day, the client's still saving $800 and their Social Security check is going to go up, not just with the COLA that they're going to get, the cost of living adjustment, which is 8.7%. And the Part B premium is going down from $170.10 to $164.90. Okay. So they're going to save $800 next year annually by switching that plan. So that is amazing. And it's an internal replacement, right? So they are staying with the same company and not doing any changes. Another thing that's really important is a lot of people is we do in life insurance, the assumption close, right? So you assume the close and that's it. And then you move on. Okay. So when it's going to be applicable to all sales, just in general, right? You assume the close. You don't ask for the client to tell you oh, can you start writing the application? They don't know the process of how to write the app. They don't know the process of any of that stuff. You have to go through it and go through it smoothly after you explain all the details. Okay, great. You explain it. They like it. You assume the close and you start writing it on up. The USAA honor PPO with RX with prescription drugs. Does that sound like the one that you want? Yes, it is. Okay, perfect. You just go ahead and start writing the application. Another thing that I see over here is HMO POS. What does that mean? POS stands for point of service. I tell you guys this, it's kind of like a PPO. It means that, yes, HMOs, just regular HMOs, not HMO-POS, HMOs, you cannot go out of the network. If you do, you pay the whole bill, unless it's an emergency. With an HMO POS point of service, there is exceptions to go out of the network to see physicians, to get care, right? So that is a good thing. It's called point of service. And you also don't always need a referral with an HMO POS. Now, still, you're probably going to need them in most instances, but that's good to know that you can go out of network with an HMO POS. It makes it a little bit more attractive to have that type of plan. So whenever you see that and it's not just an HMO, you're like, oh, okay, great. This actually might make sense. Okay. Let's see. Existing clients. So for your existing clients in your book of business, I got my pages. I got tons of sheets printed out from each insurance company, and I write them on down and I'm taking notes. And, I've reached out to them. I sent letters, they'll call me and stuff like that or whatever. Right. And you start talking to your clients. Working that existing book of business is really crucial. So the example that I gave of the Humana Gold Plus in my area, I'm reaching out to my clients directly, talking about that plan. Hey, this is the plan change that Humana had for your existing plan for the Gold Plus. Here's the new plan that they rolled out. Okay. Or even if it's an existing plan that they rolled out, they made this plan better. Okay. Even if it's an existing plan, they made this PPO better. And here's all the differences. And I think you might like it. Right. So I want to go back and make a plan change that's in the best interest of the client. So I'm marketing and working my book of business. I don't have to go back and sit down with them if they already have the plan and everything. Of course, I could do that and sit down, but I want to maximize my time. So most people, right, I'm just going to say, hey, we're good. If the plan's good, I'm just going to let them know that, hey, your plan's good to go, right? So don't worry about that at all. We don't need to make any changes. We're going to stick with what we got for next year, but I'll definitely reach out to you if anything changes. One of the biggest things that the existing clients are asking me that you guys need to address is the flex card, right? So the flex card, what is a flex card? The flex card, that's going to cover your dental, vision, and hearing. It's a prepaid debit card for regular MAPDs that, and there's on some DSNPs, but it doesn't matter right now. So with most MAPDs, not most MAPDs, but they have it for MAPDs that you can use it and swipe it. It's a debit card to pay for additional bills for dental, vision, hearing, whether it's at the office or a bill that they get through the mail. So that's a phenomenal thing, right? That's a great thing. So that's one question that I'm getting a lot. And that's a huge selling point that the telemarketers, the people over the phone are using. So make sure you're talking about that. Hey, good news is Cigna and WellCare, and you would look at the other plans to see, you just pull up the summary benefits, look in Sunfire, see if it says flex card. I always double check everything with the summary benefits. So what is the summary benefits in Sunfire? Well, I'm not going to explain what summary of benefits is. It's in its name. In Sunfire, you go in there, you create the contact. Once you find the plan, you scroll all the way down the bottom and you click summary benefits. And it's going to pull up everything. And then you can search for the different things like how much is the dental, how much is the vision, how much is the food, how much is the over the counter, how much is the utilities, does it pay towards rent, right? Every plan is going to be different. So Humana, you can use the money towards rent, food, OTC, and utilities. United Healthcare, you can't. You can use it towards utilities, OTC, and food for their dual special needs plan with their prepaid cards. So that's different from the flex card. Okay. So it's different from the flex card. So just make sure you're bringing this stuff up. Don't sell someone on this plan, paying for rent when they're not dual eligible. Right. So that doesn't make sense. So don't do that. Right. Don't sell someone on that. So it's kind of like you're pitching Royal Neighbors before they even get approved. Right. We wouldn't do that. It doesn't make sense. So we need to make sure that you verify everything first. You go into UHC Jarvis, you do eligibility. You could do it in Sunfire now, right? You go directly into Sunfire and type that information in. And when you type that information in with the customer lookup, you literally just put their info in. It's going to be their zip code, their date of birth, and their MBI number, their Medicare beneficiary identification number. So it's going to be all of those things that you're going to input in there. And when you input all that data, right, it's going to tell you their existing plan and maybe one prior plan, depending on how long they've had their plan for. Medicare.gov, sometimes it's got hangups. So there's a reason why I tell agents to always verify, and there's a reason why I have the steps. So I always have the steps because I want agents to follow the steps to make sure that we can put the client in the best plan and to verify what they currently have and what they have had in the past, right? So the steps exist for a reason, right? I don't just tell y'all to do something for no reason. I tell y'all with the purpose to make sure that we could go through these processes to really lock those sales down and to make sure that our clients become our clients for life. Well, I think that's a very important thing, guys. I really want you to understand this. This is for life. These clients will be with you for life. I left clients that I sat down with and I said to myself after I left them, because she's already given me like 4 referrals, this AAP, right? Not including last year, 4 referrals. And I'm getting all of these, great calls from friends and stuff like that. And they're asking me about it to schedule an appointment and come out and see them. And, I sit down with them and it's just amazing. And I look at it and I'm saying, hey, these people are going to be my clients for life. Right. I do right by them. I take care of them. Right. I answer the phone when they call me. I help them out. I go above and beyond for my clients, and they will literally be my clients for the rest of their life. And that's amazing. Right. And look at that from a business perspective too, because this stuff renews and you get paid a commission when it renews, and you can always help them out. And that's a huge thing, right? Referrals in Medicare are absolutely unbelievable. Final expense, you don't get referrals like you do in Medicare, right? Because Medicare, there's no cost. You could save someone a ton of money on their prescription drugs. You could save someone money on their premium that they're paying. They might be paying a premium for a Medicare Advantage plan, and you save them a ton of money. So I think that's a really amazing thing for us as agents to understand that, right? And it's really important that y'all are working that book of business, because I actually talked to a guy that I was recruiting, and I was talking to him the other day, and he's like, yeah, I've been in this business for a while and I have this many clients and whatnot. And I was explaining to him the system and the processes that I teach all agents to do when working their book of business. And he's like, guilty as charged. I don't do it myself. And I'm like, I know because I didn't do it either. Right. And it was dumb. It was stupid of me. It was selfish of me. Right. It didn't put my business in a better situation, didn't put my family in a better situation. So I really market to my book of business on the life and the health insurance side. Right. So I think that's very, very important. And I think it's crucial for us as agents to make sure that our existing clients we take care of, we're getting in touch with. If you weren't able to get in touch with them, it's a bad number, send something to the mailing address, whatever. You can do a lookup for your existing clients and try and find their number, white pages, whatever way, just be creative to find that stuff. So that's really important as well for your existing clients. Make sure they stay your clients for life. All right. Telemarketers. So I sat down with a client, like I was telling you guys, I don't get to go out in the field and sell. I didn't buy any leads for AEP because I really want everyone else to have that successful AEP that they need to have. I realize you can either be a really good manager, upline builder, whatever you want to call it, or you could be a good agent. And it's very difficult to be both. So what I want to do is I want to make sure that every single person gets the help that they need, right? To learn this stuff, to put the clients in the best situation. We're not just going for sales. We're not just going for commission. We're going to really put people in good situations. And in order to do that, you need to get the answers to the questions that are required to put clients in the best situation. So I want to be available all the time to do that. So for me, I have got out there and sat down with a couple of clients, maybe like 5 or 10, probably like in that ballpark. But when I was with them, I was just shocked, to see it again this year with the new CMS rules that came out. The telemarketers, they're just calling still 100 times a day. And it's no surprise to all of us, right? I mean, it's no surprise. This is what they do. They hammer the phone and they're on top of these people all the time. And I was sitting with one client and they called her 15 times in the 40 minutes I was there. There's no joke. It was back to back to back to back. And I was just like, wow, this is unbelievable. And I felt bad for her. And her husband was like, who keeps calling you? And she's like, I don't know. It's these telemarketers. And they're just trying to sell them Medicare. And she like answered it a couple of times and put it on speakerphone. And I was just like, that's it. So you guys have to realize that you got to use that to your advantage. That actually makes your job easier. Hey, listen, I'm not going to call you 100 times a day. If you need help with Medicare, I'm your agent. I'm going to take care of you. Right. So people that call you over the phone, they're trying to sell you something. Don't give out that red, white, and blue card number to anyone over the phone. That's like your social security number. You don't just give out your social security number. They could change your health insurance. They could do all this bad stuff. You could end up with medical bills. Right. And that's just insane. I don't want you to get $3,000 of medical bills because someone was trying to earn a commission and they're calling you 100 times a day, trying to sell you something over the phone that's not in your best interest. Right. We do what's in the client's best interest. So I think that's a really important point to kind of hammer home with the client is, hey, these telemarketers that call you a million, I'm not going to call you and bother you. Right. They're like, you get to the house, they're like, finally, someone that can actually sit down and talk with me. I have to talk to someone that's not even in the United States. Right. And they're grateful for that too. So kind of keep that in mind and make sure the clients know that as well. Let's see. Let me go to the next one over here. So we're looking at the health risk assessments. Okay. So for the health risk assessments, let me pull this on up. The payments. I know we covered this, but I'm going to cover it again because people were asking. So health risk assessments. What can you do with the health risk assessments? And how do you do them? Where do you do them? Okay. Every single company, you can only do you could write the application for every company but United Healthcare through Sunfire. So every carrier, you write it through there, and then you go into their portal. So it's at the end, it's going to say start health assessment, right? And WellCare, it doesn't even reroute you to anywhere. It does a health assessment in Sunfire. Cigna, it's done through iCario. Through their portal, you could go in there and do it. And I sent out an email about it. Humana is also iCario, which was like Revel Connect, but it says iCario when you log in. ICARIO, iCario, and then and Humana's in there. So you click that, you got your username and password. You do the health assessment in there. Let's see, Aetna, where do they bring you to? I think maybe they bring you to Think Agent, but I'm not 100% certain. I think when I did one. I think maybe I don't think it brought me to Think Agent. I don't remember. But either way, my point is simple. It's that every company besides United Healthcare, you do the health assessment through a post-sale and Sunfire. With United Healthcare, you got to do the app through Lean in order to get that health assessment. People make mistakes. I make mistakes, right? It just inherently happens. So let's go over the numbers once again on how much that's going to pay. So United Healthcare is $75 per health assessment. Humana is $60 per health assessment. WellCare is $125 for C-SNPs and D-SNPs. And for their MAPDs only, which I know a C-SNP is an MAPD, but it's a special needs plan, right? That's $75. The Cigna plan is $125, but you can get up to $175. And then Freedom, if you're in Florida, is $65. Aetna is $70 for their MAPD, regular MAPDs, and their D-SNP is $110. So that's really cool to kind of see that. That covers all the carriers there that we pretty much sell. I mean, that's pretty much all companies. If you're down in Florida, you're selling Care Plus, it's also $60 because that's a Humana company, so it's owned by them as well. So the HRAs, that's how they go. Let's go to the database. Okay, this is a really important thing. I mean, these are your clients, and you paid for a lead. You took time to sit down with them. So build up a database of these people, of these clients, right? And take notes of what you're not gonna be able to sell everyone. Right? That's the reality of sales in general. So take notes on these people. So if Humana rolls out a USAA plan with a $75 give back and you weren't able to change the person into the Humana Gold Plus plan, right? You're going to keep that in your records, and then you could reach out to them next year. So don't just, oh, I didn't get the sale done, and you forget about it and you don't do anything with it. Take those notes down, sort it, build up a database. That's a tremendous resource for you in the future. Why do I have 3,000 people to market to? Because I built up a database. That is so incredibly crucial for you guys to make sure that you're doing that stuff. In the future, like when Aetna this year, they got rid of plans in my area. 1, 2, they changed it that you can get paid on an AOR, the agent of record, change of AOR. Daryl Barton mentioned that a couple calls ago, right? You can now get paid by changing the client for you becoming the agent of record. I want you to think about that. So now if you didn't have a database of all the Aetna clients or all the clients with Humana Gold Plus that you weren't able to change, or all Aetna clients that you weren't able to change, but they liked you and they wanted to keep their plan, hey, you're out of luck, right? You are out of luck. I'm not. I kept great notes so I can revisit these people, talk to them again, you know, and especially if they're your life insurance client too, or a hospital indemnity client, that's even better, right? You could reach out to them again. They're your existing client too. So just make sure that y'all are doing that. You can get a PTC, which is a permission to call, but also keep in mind that business reply card, that BRC, that direct mail lead, that is your permission to call them. That's them basically opting in to you to reach out and talk to them. Okay. So take notes. Can't tell you all how important that is. Take notes. Where do you get the Medicare card if they don't have it? You go to you call United Healthcare or Humana, the ones that I call. I've status with them based on my book of business, the size of it. They give you status and you get through a little bit faster. So United Healthcare, you can just call them. Humana, you can just call them. Hey, I need to get this client's MBI number. They ask for their date of birth, their address, their zip code, their social security number, and they'll get you out that information. Medicaid number, you can also call United Healthcare and Humana, and you can get their Medicaid number. You can go directly into uhcjarvis.com. You can type in the info in Medicaid, okay, for Medicaid, the Medicaid verification in there. It's under tools, and you type in their social with their MBI number, Medicare on the red, white, and blue card, MBI number, and it'll give you their Medicaid number. If it's active, it'll tell you if it's active, and it'll tell you if they qualify for that plan. That's how you get that. So it's very, very important that y'all understand that. Let's go to the next one. Another question that came in was, do you need to be on Medicaid to get a C-SNP? No, you should have a qualifying chronic condition. So C-SNP stands for chronic special needs plan. So that's for people that they have some type of chronic condition. 90% of the ones, if not more, that we see that is in our territory, those ones are going to be for people that are diabetics. They are diabetics They don't even have to be on any pill or insulin, right? Doctor said that you're a diabetic, which you can manage with diet and exercise, right? But the doctor said you are diabetic, you qualify for CSNP. So you don't need to be on the pill or even insulin. But if you are, then yeah, of course you qualify too. So you enroll them in that. It's also for heart failure as well. Okay. So that it's also for heart failure. So that's important that y'all know that it's also for people with specific heart conditions. So how would you know, okay, so for a CSNP, tell me about the CSNP. How does it work? How does someone get enrolled in it? What happens? So you do a CSNP plan and you enroll someone in a CSNP plan. They verify with the doctor to see if that client actually has that type of health condition, whatever it might be. So let me go ahead and go into Sunfire. And what I do is simple. I just go down to the special needs plan section. I look at the, let's see, United Healthcare CSNP, go to details, go to summary of benefits. And then as soon as you pull that on up, it's going to have the information in there that tells you who qualifies for it and why. Okay. So that's really, really important for you to know. So you just read that on the second page. It'll say it. Let's see over here about this plan. To join this plan, you have to have A and B, and you need to have a chronic or disabling condition specifically to help people who have one or more of the following conditions: cardiovascular disorders, chronic heart failure, or diabetes. So it says it right there in front of you. So all you got to do is just pull the stuff up and read it. I think that's a big thing for y'all, is just to read a lot of the stuff. And that information is going to be really, really important for you. And it's just going to establish you as an expert just a little bit more. Let me see. I got one. Let me see if there's another one that I had over here. Okay. So the question, Steve asked a question. He said, is the give back based on income? No. And there's no, income does not matter. Everyone gets a give back plan. But if someone's on Medicaid or they're not paying the Part B premium, you wouldn't enroll them. It makes zero sense to enroll them in that plan, right? So they're already getting that Part B premium paid for, which is exactly why we do the verifications, exactly why those steps exist, right? It's so incredibly important for you guys to understand, is like, hey, if you follow the steps, you're going to be good to go, right? You're going to be good to go. So the give back has nothing to do with their income. Someone can make 100 grand a year and be on it, or someone can make $1,600 a month and not qualify for the Medicare savings program to pay for the Part B premium. All right, so let's look at a email that I got that came in from Cigna. So Cigna says top 5 reasons to write Cigna this AEP. Their new PPO and DSNP plan. That's awesome. New dental. They got $20,000 dental. I thought that was wrong when I first read it. $20,000. I was like, that is insane. There's no way it's 20 grand. It is true. It's $20,000 dental maximum and increased dental allowance limits plus dental allowance discounts. The next thing, new Cigna Healthy Today Flex Card combining retail OTC with supplemental benefits. And then it says service area expansion in Connecticut with significant network growth, including several new providers, groups, and hospitals. Earn extra money for completing the HR race. If you got questions, call Carl, or for my lady, Connie is who my rep is over here. So Connie's awesome. I can email her, I could text her, call her. I got her direct information. So if I have questions, she is a local rep in Connecticut over there. So establish those relationships. I'm pretty sure most of you already do that, but I'll tell you every single time, always do that. So Jared said our local manager for UHC told us that health assessments for 2023 should be able to be done through Sunfire. I've not checked yet to verify. No, I tried to do it and it didn't let me do it. If you guys find out that it can be done, let me know, because I tried to do it and it was not in there. When you submit the app, let me see. I'm going to go back into Sunfire real quick and see. I don't even think it gives you the option to do it. So let's go in here. Let me check. I'm going to run this date range and see. Let me see. Hopefully it does it. It does now. Wow. Look at that. Thank God. I do see it now, guys. So this is This is in Sunfire. It brings it up. It didn't bring it up on the 15th when I tried to do it. So that is freaking awesome. So I am wrong that it doesn't allow you to do it. So it looks like it allows you to do it. So get this stuff done. Look at that. That's amazing. So they must have just updated it because in Sunfire, oops, just lost that. Just trying to pull it up so I could look at it for you guys. In Sunfire, right after you do the sale, click Start HRA for each one of them. So that is awesome. That is freaking amazing. They decided to do that this year. Okay, so that's in there now for Unite Healthcare. Last year they didn't have it. This year they do. I am fired up for that. That is awesome. Thank you, Jared, for pointing that out too. And I luckily I was able to. I have already done a case through Sunfire that I could go back and revisit. So that is freaking awesome. I'm going to send out an email for that. We are good to go. Still, I personally would prefer to enroll through Lean. What I'm seeing is a lag of applications. So if you guys are writing apps and you don't see them in UHC Jarvis or, whatever, it doesn't matter, the carrier portal, but you enrolled them over there, it's important that y'all know that just make sure you're tracking this stuff. Make sure you're using AEP as your election period. All clients that I'm doing right now, I am using AEP, right? I'm not doing anything different. I'm not doing an SEP and trying to start them sooner unless it's necessary for whatever reason, right? Like they gained their Part B coverage and now that's an election period, or they lost their employer coverage. Okay, yeah, of course. Or they're new to Medicare, an initial election period. There's certain instances when it makes sense, but clients that are just changing from one plan to another, it's AEP, right? Use AEP and get that. So I am so happy right now to see that in Sunfire there. Yeah, I had an application. I had sat down with a client and wasn't able to do it in there for Sunfire. So I'm so happy to see that, guys. So just so you know, thank you. And I'm happy to be checking that out. So Mark said partial Medicaid. Can Sunfire determine which plans qualify? UHC gives guidance that, yeah. So when you're in Sunfire, do that eligibility check. So once you get in that special needs section over there, what it does is it allows you to go in that section for the special needs. It says, check to see if you qualify for the plan. Okay. So what does that mean for us? Boom. You type in their social or the Medicaid number, and it's right there in Sunfire under the special needs section, and it will allow you to see if they qualify. Of course, you can go to UHC Jarvis and do it as well. Joe has a question. Is Joe's iPhone? We'll see what Joe it is.
Hey, sorry, I was driving, so it'd be easier than trying to type everything out. Real quick, so when it comes to, and I know you just started talking about the eligibility check.
Yes.
I checked someone through Jarvis on Medicaid eligibility, and then I called Jarvis. They said they couldn't, or UHC, and they said they couldn't find them. Yeah. The person is insistent they have, and their WellCare plan they currently have, Molina plan is a dual plan as of now. If someone became somehow ineligible, would that not automatically be reflected in their Medicare card?
Yes.
And would they be?
They would lose that plan.
Got it. So I guess my question is there a potential that I guess UHC doesn't have up-to-date information on a particular case? And if so, would Humana's eligibility check provide any different data, or are they pulling from the same data?
Yeah, so that's a great question. Yeah, so the insurance companies go directly into the Medicaid database, and that's where they're pulling it from. So that's why they'll need their social. So whatever access they have behind the scenes, whenever I call and I ask them and I talk to them, they say, yep, I'm going to go into the state's Medicaid database and I'll look it up and see if that person is eligible. There is certain plans that do have different eligibility requirements. I think it was you, Joe, that actually ran into one of them where you saw that they were like eligible for one plan, but they weren't eligible for another. So some plans have different eligibility requirements as well. So some, if you go to special needs, let me just go over here. Let me just share screen real quick. Share screen one. Okay. So right over here, if you see in here, it's going to show QMB only qualifies for it, QMB plus, Slim B, and then full benefit dual eligible. So that'll tell you over here who qualifies for it. All Medicaid levels in here, right? So that's pretty cool. Now, of course, I'm still going to do a Medicaid verification. It's required of you, in fact, to do it. So, and then this one tells you the same. So all you do in the top over here is discuss with the beneficiary or contact the state, but it's got it somewhere in here. I think just because of the specific case that I'm looking at here, it won't let me look at it, but it tells you. Oh, okay. So it says Medicaid level not available in that state. So let me go to a state that I could type it in. Hold on. I'll find you guys one real quick. I just can't pull anything up. Let's see. Here you go. View quote. All right. So let me share screen with you guys for special needs plans real quick. Okay. So let's go back, share screen. Yeah. So right here it says filter by this, and then you just type in this information, social, and then boom, then you type in it. It says check Medicaid eligibility, and you do that. Another thing that's really important, which I don't necessarily want to do that. So let me go to this person. This is under David's name. So let's go ahead and let's do this over here, guys. So you can do in the profile section here on the left-hand side, customer profile. When you get to this page, after you add the contact, okay, and you're on this page, you do customer lookup. Check this box. This is where I was talking about Medicare number, date of birth, and zip code. Okay. So keep that in mind, guys. That's stuff that you can do to see what plan that they have. It's separate from the Medicaid, but it's just another note that I wanted to add in there as well. So that it should answer both questions there. Okay. So let me see if there was anything else. Make sure you're dialing your T65s in your book of business, your existing book of business. Make sure you're filtering those out and pulling all those. So let's see. Let me see if there's any more T65s. Yeah. So get the letters out to those clients. All right. Get those letters out to the clients. Make sure that's getting done. Let's see. Dialing your existing book of business. Yeah, that's most of it. Who's got a questions on anything? Make sure also, guys, that you are make sure that you're following all those steps. That's including the Medicare worksheet. Okay. Make sure you're doing that stuff. You're looking at the Medicare worksheet, you're reviewing it, you have it filled out in every single home, you're building a profile for all clients in here, you're typing in all the doctors. One thing that's really important, let me share screen again, okay? Don't pass this screen. So don't go to this screen over here and put in all the doctors and medications before doing the customer lookup. Do the customer lookup first. Otherwise, what will happen is it's going to delete all those doctors and medications, going to treat it basically like you just started over new, okay? After you do that, you don't need to click the add contact. After you do this, the customer lookup, it'll just say view all plans right here, just like it does when you got the zip code. So you just click that and you move to the next page. You don't need to click add new contact. Let me see if there's other stuff real quick. So when Sunfire recommends a plan, we assume, no, I never assume. So if Sunfire says that they recommend a plan, the recommended plans aren't even always what I go by, right? So I know the plans and that's what I'm looking at based on my knowledge, reading them and looking at them. So a plan may say it's a 10 recommendation, but that might not be the best for the client, right? So always verify Medicaid and always know which one's best. So let me show you again over here. I'm going to go back to screen share. I just put in a zip code by me. So Humana here recommends 10, right, for that PPO. So let me ask you a question. If someone is on both Medicare, just Medicare, and they're paying the Part B premium, right, and this one's got a $75 give back, I would go with this plan because they're getting $900 a year as long as their meds and doctors and everything else makes sense. So this says 10, this says 9. That rating may not be applicable. Mr. Joe, let me go ahead and hit ask to unmute there, sir.
Thanks again. Appreciate it. No, and that, I guess it kind of that answered most of it. So I guess just as a final question, even if someone is partially eligible, like for that individual that was partially eligible, it still came up. It gave me the plans that would not be qualified for under that status of LIS and the spend down that she was on for Medicaid.
Yeah. I remember that one.
So that did come through, but I guess what I'm wondering is that is there ever a case where someone does have Medicaid and it's not appearing to be the case for through UHC, and that calling like the local DHHS office is going to be the next step in confirming that?
Yeah. That's a great question. So so that they do tell you that United Healthcare does tell you that, and it'll say like if you go in Sunfire, it'll tell you that, and then also if you go to UHC Jarvis, it'll tell you that too. So that's the answer that you always get is verify with the state's Medicaid office to confirm. The reason why you get that is it's not active. They didn't renew it. You renew it every single year. So usually they have to provide certain stuff. Every state's different, right? So it might be like bank statements just to make sure the person has X amount of assets. So that way they qualify for Medicaid. So, that's important to understand as well, is more than likely what it is that it's not active. They didn't renew it. So they might be on a plan right now and they could be in a grace period. At the end of the year, the plan will end and they won't be on that DSNP. So if you ever look in Medicare.gov when you're with a client and you're looking at it and you're like, wait, you had a DSNP in the past, but right now you're just on a regular plan. And you kind of see that it was flipped from DSNP to regular plan to DSNP to regular plan, regular MAPD. And then now they're on a regular MAPD and you're looking at it, you're like, wait a second, what's been going on? Well, the Medicaid didn't renew, or they got, whatever it is, they inherited money. So they lost their Medicaid status, whatever it might be, because they had too much resources or, their income went up. They went back to work and they lost the Medicaid. So there can be different reasons, but when it comes to, calling DHHS, that's not something I really do. That's definitely time consuming. So I'll help them with what I can help them with while I'm there. And that I kind of leave in their hands. So that would really be the only reasons as to why I would not, with a client, see if their Medicaid is available to enroll in a plan, DSNP.
Okay. Yeah. The only reason was because it was like, all right, we could put you in with the plan for 2023, but it's going to determine, which way we go is only going to be determined by whether you're actually active or not. And I did go over some of that. So, okay. Point clarified. Second question I had was, I had someone who, current client, I went to go see, and turns out she did switch a plan with Humana. The person over the phone, though, got her LIS eligible. And so now, which, she's thrilled because now her medication's not $100 some odd for her blood thinner. It's $10. Problem, however, is the agent did not verify her assets, and she most certainly has more than $10,000 in her account. What would be the result of that? Would if that time comes and they verify her assets and they find out that
she'll owe the money back,
she'll owe all the money back. Okay.
Yeah. Whatever they paid for, she'll owe that money back. That's a risk I wouldn't take. Yeah. Everything with Medicare, I do by the book. So that agent, like I don't take any risk with Medicare because of that, right? Medicare, Medicaid, dealing with those. Medicare specifically, right? Zero risk, just always do the right thing by the client. Sounds like that agent did not. And it could cost her some serious money and she will not be pleased and she'll file a complaint. But in the end of the day, I don't think anything, the agent's not going to pay the money, so it's like, she's the one that's stuck.
Okay. So, and the second thing is that, sorry, Gus, on that note, can you talk to situations where I know that when you have a medication that does cost quite a bit, the person's not qualifying for LIS, the system that where you go to the actual provider, the medication provider gives them like a 1 year kind of trial run. Do you know what I'm talking about?
Yeah, you can get
where
like
they pay.
Yeah, you can get like sometimes you'll get manufacturer discounts, or the doctor's office will be able to provide the drugs at a lower rate direct from them. Yeah.
Okay, got it.
Yeah. I wasn't sure if you had a question with that too. Sorry. Yeah. So
I wasn't sure if you would talk to that. So I don't know if there's specific things. Okay.
Yeah. So that's a great point too. Those are really, really good questions. It's very good information for you all to know, because if a client's paying too much money for a prescription drug, they can go straight to the manufacturer to get discounts. So that is very, very important that you guys understand that if they pay too much money and they can't afford it, but they need to be on that drug because either generic's not available or the body just does not work with generic drugs with IC all the time, right? So that is amazing for us as agents to give them some insight as to where to go, because most people don't care and they don't tell them, right? So, hey, you can go direct to the manufacturer and call them. Here's the name of the manufacturer, right? And do it. One. And then two, you can ask your doctor to be able to provide you some discounts with these drugs directly, right? So that's very, very important as well, to make sure that they ask their physician, ask the doctor's office. Sometimes the doctor's office, I mean, you guys see it all the time, right? They get the drugs in there and they can usually give it to them at a lower price or no price, right? So that's something that they can do and ask their provider. So let's see. So Steve, yeah, so there you go. He said, in Connecticut, they only count your income, not your assets. So yeah, so some states might vary for that. Mr. Bill Miller, my man, the legend, Bill Miller. Bill, I hit ask to unmute. If you're on your phone, it's *6. You are good to go, sir. I see you unmuted.
Hey, Holden. I was just going to help answer Joe's question there a little bit. What I've run into as far as dual eligibles, Medicaid, I know here it's every 6 months that they have to reapply, or once they get in, it's much easier just to kind of send in a no change letter. But during the pandemic, the states kind of let that slide.
Yeah.
To reapply. I've run into a lot of people that had expired Medicaid numbers, and they have to go in and start over. So that's the reason I've run into it. People just got out of the habit of doing it. And anyway, that might be some of the situation he's running into as well. So
yeah, that's a good point. Yeah, I mean, it expires, and if they don't renew, then they're not going to get it, right? I mean, you got to renew the stuff. They have to do it, and that's our job too. So in Texas, they get their letter, and in the top right hand corner, it gives them 1-800 number, and then it also says call 211 to get more information, apply for it, and stuff like that. And a lot of states are actually 211 from what I found as well, guys.
And finally, I'll just say this. If they walk in with an expired number, if they can get to the office, they'll get it a lot quicker. That's happened a couple of times.
Yeah, that's a good point too. And I tell people that as well. It's very, very important, hey, just go down to the office and you'll be able to get the information. And sometimes for a lot of the seniors too, it can make it easier on them. But I always tell them, hey, go first thing in the morning.
Right.
Awesome. Well, I appreciate you. Let me see.
Thank you, Bill.
Here. Yes, sir. Yes, sir. All right. So Daryl, I'm just texting you just to ask you, so I know you're out there and you're hustling. Daryl, do you have anything to add about leads or some stuff like that you have some feedback and stuff that you want to add into, Daryl? I always like when Daryl adds stuff in because he's amazing at the Medicare space. Let me go ahead and let's see. I'm going to answer Mark's question here. So if they go back and forth with Medicaid or partial year to year, and Sunfire shows a D-SNP, now after we qualify them for your Sunfire, then they get DQ'd. Can we? Yeah. You can move them around. I mean, if there's an election period, an SEP, a special election period, that is loss of Medicaid status or loss of status. So it could be Medicaid, it could be extra help, change in status, I think is what it's labeled under. You'd have to read the SEPs. But yeah, if they lose it, they go into a grace period, and then they're responsible for the cost sharing, right? They're responsible for the co-payments. They're responsible for the co-insurance. They're responsible for the deductible. They're responsible for the premium, if any, right? If there's a premium, or deductible. So they're responsible for that cost sharing now, and they're out of that D-SNP, and they'll have to go into a regular Advantage plan, and you would be the agent to do it. Mr. Barton, I hit ask to unmute there. Sir, go ahead.
So regarding leads, you must have been reading my mind. We have earned the right to ask for leads when we're in the house. If you have gained their trust and confidence, completed the enrollment, that is the perfect time to ask for those referrals. Ms. Mary, who else needs to hear from me so that I can take care of them as well as I'm taking care of you? Who else? Grab a pen, grab a piece of paper. Don't look up, Ms. Mary, I just need names and phone numbers. And of course, you know what we could do? Let's just sit here and make some phone calls, and let's go ahead and call your friends. Now it's compliant because I'm not the one making the phone call. Ms. Mary can hand that phone off. I can get permission to call them, speak to them, and get their verbal approval right there. If I want to get in the house, if I want to be overly compliant, I can always get my permission to call, signed when I'm there. Always be very compliant. We don't dance around that subject at EFIS. But you've earned the right to ask for referrals. Now they know who do seniors know. They know other seniors. They know all the girls that they run around with. Gang, I'm just telling you, we're missing such a great opportunity if you're not getting referrals. One of the things that I'm doing a little bit different this year is that I am making a point for my brand new enrollees to go back in January and help them set up their mail order for their drugs, how to use a healthy benefit card, really go the extra mile. That's going to be another opportunity for me to ask for OEP, which we'll talk about that down the road, not today. But how do you set yourself up for success during OEP for the first quarter of the new year? So if you're going to go in January and you're going to go the extra mile and really bring that client in to where you are going to be their lifetime agent, that's another great time to ask for referrals, but ask for those referrals for OEP. Okay, I'm just telling you, if you've bought leads and you're hooked up there, you could double those leads with no cost with referrals. You're leaving money on the table. Hold on, I could just run on and on about leads and lead gen for Medicare, but I'll stop right there. I think that's enough said today.
So yeah, no, I actually want to go into a little bit more. I just want to ask you a question on that. So one thing that's really important that he just mentioned is people that are new to Medicare, they might not really trust someone or, have someone that they rely on and know because they're not in Medicare already. So Daryl might have a client that is enrolling in Medicare for the first time, right? And they are aging in as well as their friends in that circle, in that group. So Daryl has now just expanded his T65s. And how much do you get paid on a T65? In Texas, $601 plus an extra 75, 125, right? Whatever it is for the health assessment pending the carrier, right? So you're making close to $700, right? So if Daryl just found, this honey hole and this one client that he got off of an FE lead or a Medicare lead, it doesn't matter. They're his client. And now he's getting these referrals, right? All these referrals that I have, these are all inbound calls. Just tell him, hey, yeah, just call me. She's like, hey, can I have cards and can you send me stuff? And, can I have my friends call you? Absolutely. Of course. So yeah. And the biggest thing that Daryl said there too is go the extra mile with his clients, revisit them again, right? Talk to them, establish a strong relationship. They are clients for life. I can't stress how important that is. I mean, let's just do the math. Let's just do the math real quick because numbers is what doesn't lie, right? The first time that they enroll, you get $601 plus a $75 health assessment at $675. If the client lives for 25 years and you sell your book of business or whatever, right? Let's take 25 times $301 and you're going to earn more commission. That's $7,025 plus the original $675 that you had. That's $8,200 off that client. What if you did that for 500 clients? $4.1 million. That's some serious money when you have clients for life. I know 25 years, and I'm trying to make the point, of course, right? If it was even 10 years and they lived. We're dealing with the senior market, people die. That's inherent of it. But I think y'all get the point there. Referrals. They come in and they're very strong with Medicare. And then after you do the Medicare, because what happens a lot of times, agents get in the home and they just sell a Medicare plan and they don't ask about hospital indemnity. They don't ask about life insurance because maybe you're moving fast and that's fine. But in January, you're going to schedule appointments with your 100 clients that you wrote during AEP. Okay. And you're now going to compliantly talk about those other products. So if you didn't sell a hospital indemnity, shame on you. Hey, but you got another opportunity. Go see him again. Hey, let me help you with this. Let me help you with that. right? My clients love me because of exactly what Daryl just said. I go the extra mile, right? They don't. Have you ever sat down with a client that says that they like their agent and they don't want to change? I'll ask my agent. I'll reach out to my agent, right? Have you ever had that before? That should be you, and that should be what your clients are saying about you to other potential sales poachers. I'm just kidding. They're not poachers. They're just agents trying to get a sale. All right. So that is about it. Actually, there's one more. So I got this question a couple times today. So the one that Joe and I were talking about earlier, we were just texting about, and he says that the United Healthcare, he wasn't able to get the PCP ID. So if the doctor's not in network, or if the doctor says that they are in network, right, and they work at a clinic, and that clinic has 5 different doctors there, or there's 5 different physicians, PAs, or nurse practitioners right there, and they don't even see the doctor. They don't even know who the doctor is. I try and go on the website, and I'd be, creative. If there's 5 different PAs and the PA isn't showing at physician assistant, isn't showing up in UHC Jarvis as someone that they can select as their primary care provider, right? I then go and I try and find the doctor, the medical doctor, the MD, right? And if that MD isn't coming up, I go on their website again, right? And I just verify, as well as call them. Hey, do you take United Healthcare? Great. Hey, this doctor wasn't showing up. Is there any other doctor that I could write on the card? They'll give you other names. If it's usually gonna be a practice of other doctors, and there's usually going to be 3, 4 other doctors that you can find on there to put on the card until that physician shows up in the network, whether it's just renewing the contract or whatever it is. And you just tell the client, hey, for this one, your PCP, this is the same doctor that you're going to see. You're not going to change anything, same office and everything, but they haven't renewed their contract as of yet. So here's the name that they told us, the office told us to write on the card, and then we can go ahead and we can change it later if necessary. So you just get the application submitted and everything, and then post-sale, we can go ahead and we can make that change once that doctor shows up in the network. It just might be an issue if they're telling you over the phone, yeah, we take that insurance. That's the assurance that I need to make sure that client's in the best situation and they can still go see their provider. So we never want to mess with that stuff. All right. So just want to make sure I'm looking at the chat box, make sure I answered every question here. Cool. All right. Well, I do appreciate everyone for joining. As per usual, y'all the best. Just keep going out there. I'm so happy to see the amount of production that y'all are doing. Keep in mind, every 30 applications is 10 grand. You get 90, that's $30,000. I don't know what that would do for you and your family and your business, but I think it would do a really amazing thing for you and give you a great start in the year for yourself to really have that business bank account just built up. And I think you'd be incredibly grateful for that. So stack your gratitude, right? And just go out there and continue to do it. Y'all are doing a phenomenal job, and I appreciate you for joining. Have a wonderful evening. I'll see y'all next week. Thank you so much.